Hi, I'm Dr. Bodner with the Bedford Chiropractic Clinic. Today I was going to talk to you about elbow pain. Seeing a lot of elbow pain coming into the clinic these days as people are getting back into summer activities, whether that's swinging a golf club or a tennis racket or a pickleball racket. We're seeing people causing new injuries. Even digging in the garden can cause some strains. So typically what happens is we've been less active over the winter, and then when summer hits, we start doing a whole bunch of new activities and we overload the tendons and the tissues. So if you're seeing the pain on the outside of the elbow in these muscles here, that's often referred to as tennis elbow, but that's a lateral epicondylitis. And on the inside of the elbow, technically is referred to as a medial epicondylitis. It just means where the tendons are attaching into the elbow that become inflamed from overuse. So if you're having some pain on the outside of the elbow, one of the things we want to try and do is stretch those muscles. So for the outside of the elbow, you can grab onto those 3 fingers and pull back until you're feeling some stretching down the back side of the forearm there. If the pain's on the inside of the elbow, you can just do the reverse and pull back in the opposite direction to feel that stretching through the forearm. Okay? So doing a little bit of stretching to help loosen up the muscles. You can massage the muscles to try and loosen them up, but we also want to strengthen the tissue. The starting point for strengthening is what we would call an isometric exercise. So isometric, there's no movement. So we're going to hold the arm still, and what I can do is I can push down. So I'm pushing down on my wrist, but I'm using my forearm muscles to resist that pressure down. I can also do that if I could rest my arm on a table, and I could push down on the arm. So I'm just using my wrist muscles to hold my arm up. Okay? I can obviously go the same in the opposite direction, where I'm trying to force my wrist backwards, but I'm resisting. Again, resting the arm on a table and pushing down, or just resisting against myself. But the idea is to take those muscles and those tendons and make them work a little bit against resistance. We don't want to get too aggressive, but we want to work hard enough that we feel a little bit of tenderness in the muscle, maybe a 2 or a 3 out of 10 to make that muscle work. Then give it a rest, do a bit of stretching, and do it again. You can do that 3 or 4 times in a row, holding it for 10 or 15 seconds each.